Thank you very much, Iggy. Just to clarify, I'm not a PHP candidate, I'm a PhD candidate. I cannot code in PHP to
Sorry,
save
did I say PHP? I mean PhD. You knew where I was coming from, okay?
minor detail, but yes. So thank you so much for having me. I'm really excited to be speaking at my first international conference. And let's jump straight into it. So I first just want to introduce everyone to a little bit of who I am. So I'm Liz. I'm a practice lead for UX and UI design at companies called DBT. We're a software development company. I'm busy with my PhD in health humanities. So looking at how design can help healthcare and improve healthcare. I'm based in Pretoria in South Africa. I play violin in 1800s cover band, which, if you think about it, is all a classic orchestra really is. And then I love going on adventures. I've climbed Kilimanjaro and I love going to different countries. I was actually in Amsterdam over Christmas and New Year last year. And I must say, your Oud en Nieuw is something that I've never quite experienced before. So the photo on the right is New Year's fireworks in Amsterdam. It was interesting, to say the least, and definitely something I'll remember for the rest of my life. So getting into healthcare and trying to understand, but why am I passionate about healthcare? Because when you think about design, it's not necessarily healthcare isn't the first thing that comes to mind. So for me personally, I've realized that healthcare is very often thought about in terms of technology. You think about technological advances, you think about the amazing strides that are made in terms of technology, in terms of whether it's looking at how your genetic profile can be used to solve different diseases, even the amazing strides that are being made at the moment with people trying to find solutions to the virus. And there are such incredible things that people are looking at. But in the whole process of that, the humanity of it gets lost a little bit. When you think about medicine, you very often think about the doctor and the patient that are interacting. But the reality is there are so many more people involved in this process. There are family members, there are aides, there are lab techs, cleaners, medical technicians, nurses, porters, admin staff. All of these different people form part of the medical experience. And we very often don't think about the bigger picture of this when we start looking at design in healthcare. Now, just to give you an idea about why I personally am so passionate about this topic, that's me, who is a designer. And to show you a little bit about my family tree, my brother is a radiologist. My father is a surgeon. My one grandfather was a radiologist. My other grandfather was a GP, who was a superintendent of a hospital as well. My one grandmother was a nurse. My mother ran my dad's practice for 40 years. And my sister-in-law, she did genetic brain profiling as consultations. So my whole family is involved in healthcare in some way. And if you look at my extended family, you'll see that half of them are either doctors or in healthcare in some way. Nurses, nurses or physios or dentists, something along those lines. So I grew up having a lot of empathy for the people that are on the other side of this, not necessarily patients, but the healthcare providers, and understanding and seeing that my dad coming home at 2 o'clock in the morning and while being on call, being called out at 3 o'clock again and barely sleeping for weeks at a time. But it's because it's something that he was passionate about. So it's something that I care deeply about, is looking how we can actually help the healthcare side and help our doctors and physicians and other healthcare providers, and see how we can use design as a way to improve their lives in some way. Now, looking at human-centered design, some of you might be familiar with it, but just to make sure we're all on the same page, the idea of human-centered design is that it is design that puts people first. It's very easy to look at technology and make that the basis of what you're designing for. But in the end, we need to focus on the people and make sure that we keep them first, because in that way, the experience that people are dealing with will be the best. So as a simple example of that, look at a kettle. So in my opinion, this is a beautifully designed kettle. It has nice shapes, it's very aerodynamic. And yet a friend of mine who was a co-worker told me the story that they had this type of kettle in their office, which was about 20 people, designers and developers. And every time they'd use this kettle, it would obviously boil. And you could only have enough hot water in this for about 4 or 5 people at a time. So you would open it to fill it with more water to boil it again. But since it had just been boiled, there was steam coming out everywhere. So the second you try to touch it, you would burn your hand. So this is a very well-designed kettle if it's only for 1 or 2 people using it. But if you have a lot of people trying to use it at the same time, suddenly it becomes a very badly designed kettle because it wasn't made for mass use. So just another way to think that even though something might be beautifully designed, it's not necessarily thinking about the people that will be using it, especially if it's in a different case than what it might have been designed for in the first place. And another example. So all of this technically gives you all of the right information for when you're allowed to park in a specific space or not. But it's completely nonsensical as to when this is actually allowed or not. I'm sure it makes sense to the people who, put them up one by one, but a normal human being would really struggle to actually find out when they are allowed to park or not. And it can so simply actually be solved and to make it clear when you are allowed to park or not, by just making a simple graph and making it more human-centered and making it more friendly to understand when you can park certain places or not. Okay. So now that we have a vague idea of sorry, I'm just noticing comments. I hope everyone can see the presentation full screen, or do I need to turn off my camera? Let me turn off my camera. Okay, then you can see it full screen. Cool. So looking at principles of human-centered design, it's important to actively involve the people that will be using the system in the creation of the solution. As designers, you don't necessarily have the full context of what you're designing for, which is why you need to involve other people in that. I am not a doctor myself, so where I can assume what people need and what they think, that might not necessarily be the case because I'm not the person working 30-hour shifts at a time. You also need to determine when is it necessary to delegate certain tasks to a person or to a machine. There are certain things that humans are incredibly good at. There are certain things that machines are incredibly good at. And if you can use that to assist people, why not? But do not expect people to make up for that. It's also very important to iterate your solutions and incorporate feedback. This is part of design thinking, and I think still a very important thing to bear in mind, that iterating solutions and seeing what works and what doesn't is very important. And then lastly, it's very important to have multidisciplinary design teams. As I said, you need to look at lots of different people as part of your team to see who can help. So include the healthcare professionals, include business analysts, include the developers. Everyone has a slightly different point of view who will help to give you more context of different things that you can do. So now that we have an idea of what human-centered design is, still haven't gotten quite into how this really relates to medicine, because it can seem like quite an abstract concept. So as I mentioned, there are a lot of different people inherent in the healthcare space. And we very often forget that all these different people need to be considered and need to be catered for. So the first case study that I'd like to take you through is the Adventure series that Doug Dietz and his team created. Doug Dietz is a industrial designer that works for General Electric. This is a TED talk of his, a snippet of it that I'll show you. I will highly recommend that you watch the whole thing. And he talks about how they looked at what people were struggling with and a solution that they came up with.
I thought I'd start with this, which is kind of a little bit of the thread or the kind of the heartbeat of my story today. And you've heard a lot about the design thinking and the design process that a lot of these folks have gone through, very powerful tools. And I just want to emphasize that empathy at the beginning for me is something that I think is really what is the heartbeat of the project when you move forward. And a lot of times when you move forward into the iteration and prototyping and some of the design phases that you go through, you need to actually refocus back and see what the empathy was that actually got you started at the beginning. So I thought I would just share a quick story with you guys. And this is a little tough story to tell, but I'm going to give it a shot. So I had just finished designing a big MR scanner. How many people here have an MR scan? It's a big MRI scan. Oh my gosh, a lot of you guys, so don't charge the stage. So I had just finished designing this big MR scanner, and I was very proud. I think I had worked on this thing for probably about 2 years. And I'm an industrial designer, and I was doing the enclosures and the controls and displays and the coils and patient transfer, that kind of stuff. And I was so excited to see this, the first product that we installed. So I went to see it in its actual environment in the hospital. So I was just running through this hospital to check out my new product that I had just finished. I'm really excited. And I kind of almost like barged in, took my wallet and all the metal stuff out of my pockets, and ran in and was, with my baby, I was just a proud papa, basically. And I remember the technologist coming in and saying, we have a patient that's going to be coming through. So could you step out for a little bit? I said, sure, no problem. I'll come back in. We can talk later. And I remember walking out and I was standing in the hallway. And this is kind of what I saw down the hallway. I saw this young family coming down the hallway. And I'm just standing in the hallway. And they're coming toward, and I can tell as they get closer, the little girl is weeping. And as they even get closer to me, I notice the father just leans down and just goes, remember, we've talked about this. You can be brave. And they turn to walk into the MR suite, and I kind of follow them in. And I still remember it like it was today, guys. I'm standing behind the little girl. She's probably about 7. And I'm looking into this environment that I was just standing in. I was just in there in this environment, just, doing my happy dance, right? And she just freezes. And looking at her angle and just seeing in that same environment where I was just standing, I realized that this is something totally different. On the wall is that, horrible warning sticker. It's got the magnet and the big exclamation point. It's got that yellow and black tape, like on the thing, like, almost like a accident scene. Everything looks really kind of like beige. It's got this kind of weird colored flooring and, just kind of everything's bleached out. And then the room itself is kind of dark, and it kind of has those flickering fluorescent lights. And the machine itself that I designed basically looked like a brick with a hole in it. And then, of course, an MRI, for you folks that have had one, it is just a terrible noise. So the little girl just starts to really cry. I mean, she's just breaking down. And I can tell you guys, I'm standing behind and I see these parents. And for you guys that are parents, they're looking at each other. They don't have to say a word because they don't know how they're going to get their child through this.
So that's just the first bit, him introducing the project that they worked on. And for those of you that are not familiar with an MRI machine, this is basically what it looks like. It's, as you said, very beige, very sterile, very clinical, and it's very practical. It works perfectly. And it just goes to show that this thing that he had been working on for so long, that he was so proud of, he never thought about how people would be experiencing this. So in their case specifically, this was being introduced into a pediatric hospital. And he worked with a team of people, including, they worked with child psychologists to try and understand how children grow and how their mindsets work. And their team eventually thought about using the creativity of children and their imagination in creating a better experience. And through doing this, they then actually managed to create what they called the Adventure series, So this has been implemented in numerous hospitals across the US. I understand that it's being implemented in South Africa in certain hospitals at the moment as well. And it's not just a visual experience. They have storylines tied to this. They have aromatherapy. In some of the rooms, he talks about how they have pina colada scents. So when the parents and the children walk in, the parents sort of stop and look at each other. They're like, wait, is that? Ah, and it suddenly gives them just a sort of nice reminder of maybe on their honeymoon, they were on a beach somewhere and they had pina coladas. For the kids, they have bubbles that come up in certain places. They have bright lights that simulate bubbles going across the theater room. They have little outfits that the kids wear and storylines that they tell them. So suddenly this is not just a medical procedure that they have to endure and go through and that the parents have to sort of get the kids to survive. It's something that actually becomes vaguely enjoyable or at the very least less traumatic. So to give you a quick example of a patient actually experiencing this.
Well, we're here today for a CT scan of Duncan's sinuses. He's had some really chronic congestion and coughing. So we're going to have a look and see what's going on in there. And the pirate room was pretty cool. The room was painted completely like a pirate setup, including the floor. The floor was like at the dock with the water on the sides, and animals and things on the walls. And the CT scanner itself was like the wheel of a pirate ship. It's for a child, it can be kind of scary. You see things that make noise and look very institutional, and this is. You're not even really thinking about the fact that you're doing a procedure. Very, very welcoming, very whimsical and fun.
And it's by simply taking the insight that children have like these incredible imaginations, and you can utilize that to improve their experience of something which is necessary for them medically. So they improve the patient's experience, the family's experience, the medical technician's experience. And at this point, some people might go, okay, well, that's all good and nice and well, but where's the business case? Is this actually valuable from a medical point of view and from the point of view of looking after the bottom line? Because let's face it, as much as we want to help people, unfortunately, if there isn't a solid business case for it, very often clients won't necessarily consider that. And I'm very glad to say that there is a very solid business case. I mean, if experience didn't make a difference, I think most of us wouldn't have jobs. But besides that, in this specific case, they found that about, I think, 95% of all child patients needed to be sedated for the procedures because they were so traumatized and so scared. Because for MRIs and CT scans, you generally need to lie still for about 40 minutes, which is very difficult for a small child who is terrified. So by making the experience better, I think he said that in the 2 years since it had been implemented, they had only needed to sedate 3 or 4 children. That is a massive reduction in the number of children that needed to be sedated, which means that less anesthesiology needed to be implemented. The procedures were able to be a lot quicker because children didn't need to be sedated. It was a lot cheaper for both the medical aides, the patients, the hospitals, etc. So while being a good thing from a human point of view, it was also really good for the hospital. And overall, they found that the doctors and the radiographers who were conducting these tests also really enjoyed it a lot more because they didn't feel like they were traumatizing the patients. They really felt that they were actually helping them. So to show you a few more examples, there are so many ways in which human-centered design can improve healthcare. One of those is helping to relax patients with medical virtual reality. So as part of the Adventure series, they actually developed some VR goggles that didn't have any metallic parts because you can't have metal parts within a MR machine. MRI machine. So that helped to also have the kids look at a story or listen to a story while they were undergoing procedures. Kids could also play games while they're busy with procedures, and this really helps to calm them down and to help them to focus and not worry as much about scary needles or whatever it might be that they're undergoing. There have been some interesting cases about women giving birth while wearing VR headsets, which has shown in these cases to really calm women down and make them feel a lot more relaxed, because they are not as focused on the fact that they're in a hospital. They can feel like they're on a beach, calmly giving birth. And from the women that have actually done this, they've said that it really did help them quite a lot, which is a very interesting way of using this application. Another interesting example is the TR Health app in the United States. It's a personalized health app specifically aimed at women, trying to help them personalize their healthcare and what they need. So you can list your different symptoms, you can track them, and then see how they correlate. And it helps you to understand what you need and helps your doctors to understand what you need to focus on. So after this app was very successful, they then started opening clinics for gynecology practices. And they also realized that they didn't want it to be clean, clinical, scary places for women to go. So they created these offices to be more friendly. And you'll see that the design overall, this feels and looks like a spa. This doesn't feel like a doctor's office, because they wanted women to feel more comfortable and more open to what they were experiencing. And it's gone down incredibly well. They have very, very good, had a very good response to these clinics. Another interesting example of looking at the people who are using your service is gamifying healthcare. So in South Africa, we have a medical aid called Discovery. They've launched their Vitality program in a few other countries as well. And they specifically reward people for being active and for exercising. So you get points with your smartwatch for going to the gym, going on runs, participating in race events. And as you build up points, you get rewards. So you might get smoothies, you'll get discounts on exercise clothes, all sorts of things like that. And they have an incredibly good response to this, and a lot of people being a part of this program. And it's really encouraging people to be healthier, and people love competing with each other and saying like, oh, but I'm on gold status. Oh, but I'm on platinum status. I worked for this client at one point, and people were so proud of the status that they had it as part of their email footers, where they would say which vitality status they were on. And it's such an interesting way of getting people to engage with their health and being a lot more aware of it, just because you're thinking about the people and engaging them in that process. So I'd like to take you through some examples that a company here in South Africa did. They're called Gembi Health. They're a nonprofit organization looking at healthcare and design. And they did a project where they wanted to empower parents on their children's healthcare journey. So they realized that there was a problem in between Tanzania and Uganda, where parents were migrating quite often between different houses for jobs, etc. And that was making it very difficult to keep track of the children's immunization and the healthcare that the children were receiving. So it was very difficult for, obviously because it's different countries, for the different countries to keep track of what things had been done. So they wanted to help the parents really understand and be proud of the fact that they take charge of their children's healthcare. So they focused very much on the parents and getting them to understand why this is important. So they created cards which saved NFC data on the children's journey, and created an app that was utilized through this. And they made a point of packaging these cards and the information that explained how this worked in a very beautiful, luxurious way, so that they felt that this was really a product that they should be proud of, and they should be really proud of these cards. Oh, I see Zane is joining us. So this is in the chat, Zane Dickens, this is one of his case studies. He wrote an article about this recently. They've done some amazing jobs. So I'm stealing some of your work to talk about how awesome it is, Zane. And it's a really amazing example of using the way that people think about things and making them proud to be that person who is in charge of their child's healthcare. And they found that people really received this very well. The people who were standing in the queues with their cards were actually bragging to other people in the queue about their cards. And they had such an amazing response about people really being proud and wanting to take charge of showing that, look, I'm looking after my kid, and these are the different things that my child has had done. And it made it a lot easier to keep track because the people were willing to engage, and they managed to find a way to get people to be part of that process. And then another example, which is also from JMB, is they were looking at an HIV clinic, which they wanted to help the data capturers with creating a paperless system in a rural area. And they thought about asking, okay, what would be the number one thing that would enhance your work? And asking the guys who were doing the data capturing, they figured, it will probably be a feature or something that, relates to their job and will make their jobs a little bit easier. So something along the lines of, making the software capturing easier. And instead, what they told them is they would really like an aircon. So looked around the office, which was a container, which was built in somewhere overseas, and which one of the donors had sent from Europe to Africa, realized, okay, this thing wasn't really built for the African summer. So yes, it was incredibly hot in this room, very uncomfortable. Said, yes, that makes perfect sense. An aircon would be great. And the guy said, actually, no, we don't want the aircon for us. We want the aircon for the pharmacy, because they're dealing with antiretrovirals, medicine for the people. And when these antiretrovirals become hot, their efficacy drops and they expire. And it doesn't matter how good the data is that's being captured if it's based on unreliable medicine. So just the assumption what you think people might need could be very different from what the reality is. So in the clinic, what their solution was to reduce the prescription amount that was being given to people. But this then meant that people had to visit the clinic a lot more frequently, which meant that they had to travel more frequently, had to take off work more frequently, had to arrange childcare, etc. And by simply not having an aircon, it had this escalating fact on how people actually experience their healthcare. And it's not something that we necessarily think of, that the problem that you think you need to solve is not necessarily the problem that people are really dealing with. So it's not about just solving a problem. It's about needing to solve the right problem and truly understanding what people need. So considering that we are in the middle of a pandemic, I figured I would look at just a few examples of what kind of human-centered design has been happening during this pandemic. And there are a few quite interesting examples. So for the doctors and the healthcare workers that are currently working in the hospitals and working on the front lines, they obviously need to wear protective gear. And this can be quite terrifying to someone who has to go into hospital and see people wearing gloves and masks and goggles and various types of protective gear. It can be quite intimidating and overwhelming, and I would be quite terrified if I saw these people while being sick myself. So the simple solution that quite a few doctors have found is to put photos of themselves and their names on their protective gear. it's such a simple solution, but it's something that just ties into that human element. Just to say that I know that I look a bit scary right now, but this is who I am, and I'm here to help you. It's these small things that help people tie into their humanity and make them more comfortable. Another interesting example that I found is, this is Quentin. Quentin is a robot, which is a iPad strapped to a Segway, which can be controlled remotely. And this is in Tegenberg Hospital in Cape Town. And the reason why they developed this is for when the doctors themselves get COVID-19, that they are able to still perform rounds and help people from home. So while this might not seem like human-centered design initially, because it's literally a robot, this is literally to actually help people so that when doctors themselves can't physically be in the hospitals because they are at risk, they can continue to help people. And I find this such a beautiful mindset, that they want to continue helping people even when they themselves do get sick eventually. So in closing, I would like to show you just a quick clip from Doug Dietz about him speaking when he realized the impact that their human-centered design had on their patients for the adventure series.
Cool. And the story that goes with this one is, so I'm talking with the parents about the pina colada, actually, and the little girl had already just had her scan. And I'm talking with the parents, and the little girl keeps coming up and she's pulling on her mom's shirt. And about on the second or third time, the mom, kind of interrupts and she goes, "What is it, honey?" And the little girl looks up and she says, "Can we come back tomorrow?" So I'm just, that's a pretty powerful thing.
So I just find that so beautiful and so powerful, that something which kids were terrified of and something which he had realized was a very big problem, they managed to resolve in such a way that people weren't just enduring it, the kids were actually enjoying it so much they wanted to come back. And I believe that that is why human-centered design is such an important thing in medicine, because it's so easy to get wrapped up in the very cool tech and machinery and to forget about the people. And that's it. Thank you so much. I'll share some of the links. I haven't checked. I saw Melissa posted a link there. I'll check whether that's the right one. But there really are some amazing examples of people utilizing human-centered design and patient-centered design. And I find it really beautiful that in this time during the pandemic, people have started looking and noticing a lot more about the healthcare providers and how exhausted the doctors are and how scared they are, being on the front lines and being exposed to some terrifying experiences. And the fact that they keep carrying on in order to keep people safe. And I think it's our job to support them as much as we possibly can. And it's great to see that a lot of people are doing that.
We just have one question here from Paul, and can you give us some insights on accessibility?
Accessibility for doctors, for patients. Just need to clarify that a little bit, maybe.
Okay, I'm sure you'll probably comment on that. Can you see the questions popping up on your side?
Yes, I can. Accessibility, how important is it to these experiences? I do think it is very important. I mean, if you think about virtual reality, obviously someone who is visually impaired wouldn't really have, the same kind of experience, or wouldn't really be able to utilize that kind of experience. And I think it's important to consider that and then to see how you can use that in other ways. Yeah. I don't really have a solid answer for you on that, but accessibility is obviously always very important to consider and to include as many people as possible. And someone said earlier today that you should be designing for the masses, but testing the edge cases. And that makes perfect sense to me. To just make sure that you are actually including everyone as much as possible. I see we have a question from Sarah, which is, have you come across any issues with interviewing existing patients? Yes, so there are always obviously some ethical concerns when you are interviewing patients. And I think it's just very important to be very clear and upfront about what you want and what you need from them, and be very sensitive about how you're approaching it. Because people who are patients, they are most likely already in a very delicate state. Because being a patient, whether you've cut your finger or whether you've broken your leg or whatever it might be, they are already in a situation where they might be uncomfortable. So I think you just need to be very empathetic and be very careful with the way you approach it. The second that you realize someone is becoming uncomfortable, you need to leave it and not push too much. Because you don't want to make an already difficult situation more difficult. And then also, obviously, just get permissions from the people and from the hospital and so on if you are interviewing patients in hospitals. From Zane, have you had difficulties with buy-in from executives and stakeholders? If yes, how did you overcome this? So it's always difficult working with executives and stakeholders and getting them to understand why this is truly a valuable thing. And with the clients that I have worked with in the past, I was lucky that they did understand the value of engaging with patients to understand what their needs really are in order to solve the issues. I think a large part of our job as designers is educating people and getting them to understand why design is an important thing. It's not just designing buttons and making things pretty. It's about finding what the real problems are, because it doesn't help if you solve something beautifully and perfectly if you're solving the wrong problems. And it can be difficult convincing stakeholders that this is the thing you should be focusing on. And I think the difficult part is creating that relationship where they truly trust you and understand that you really do want the best for the company as well as the people, and that it benefits them to actually look at what the people truly need. I hope that answers your question. And let's see, from Frederick, how can you balance the needs of the medical staff on the front line and the needs of people managing hospital and taking decisions? That's a very difficult one, because it's again business versus the people. Business is always going to try and push for the most efficient thing that works, whereas that might not necessarily be the best experience. And the best that I can say is you need to help them to understand that by creating the best experience, you're more likely to help people. So as Melissa also said earlier, a large part about being a doctor is there's a lot of stress involved, and there's a high percentage of doctors that burn out and that struggle to deal with the amount of stress that they're under. And if you can make their experiences better, you are more likely to help them avoid that burnout, which in turn means that you have happier doctors, you have happier healthcare providers who are in turn able to help the patients better. So it's about helping people to understand that it's not just looking at one person or one process. It's looking at the holistic system and the cascading effect that it has. If you help people be happier and perform their jobs better in one space, it helps everyone in the long run. Because the easier you can make processes for people, the better it will be for everyone, even though it might not necessarily seem like that in the short run. And I guess that's part of the problem with business, is trying to make a business case about experience, because it's not necessarily a tangible thing that you can, show this quarter. Our we have, made this much more money. It's a bit more intangible, and it's difficult to get people to understand that sometimes. But there are luckily some studies that have been done that do show that improving experience and helping people with psychological burnout does benefit the company in the long run. Hope that helps.
Excellent. Good answer.
Oh, thank you. I see there's another question from Theodora. Thanks for sharing your insights. I'm working with the NHS across the UK for the last few years as a healthcare designer. And indeed, when you talk to patients, you must be sensitive. But when you do field research, I'm curious what your main field research techniques or methodologies that you use when you approach your users. So that's a bit of a difficult one, just because the research that I'm focused on at the moment is mainly aimed at the doctors, not so much looking at the patients. For previous clients, I have been working on client things. When it comes to my PhD, I'm specifically looking at radiology and how to help the doctors in that space. So I can tell you for that, I'm looking at field studies, journal keeping. So that's an interesting technique of, I'm asking them to keep a journal of their insights, their frustrations, their challenges during a 2-week period, because I can't necessarily be in the hospital with them every second of the day. It wouldn't make sense. I wouldn't understand what they're doing half the time. And it's a way for them to then actually tell me insights that they come up with on their own. And I think the same kind of technique could be very useful for patients, trying to understand what their daily routines are, things that are normal to them and that they have formed habits of, that they might not necessarily realize there is an opportunity in that area for you to address. So it's that interviews and focus groups I've found have been very effective techniques, as well as workshops. So sitting down with people and looking at what current journeys are, and then asking them what are their ideas of what potential better solutions could be. So this is the current journey, for instance, for booking a consultation. What would their ideal journey be? And, making it completely out there. So maybe their ideal consultation would be, having drones bring them medication directly after a virtual consultation. You don't know. But if you make it so that there are no limits and people can think of anything, you might be able to find a small way to actually make that realistic. You never know. Cool. Any more questions?
Thank you so much. I think we're done with that. Thank you very much, Lizette. I really appreciate it.
Thank you so much for having me.